body not gently. Mr. Coco Panda Ramite, so sickness, na motamani enemy, na motamani enemy. So if you get sick, do ya know either more? Make you doctor, cause now well body better pass the.
Good afternoon, good morning, good evening. We fumble them, usai ever una day na the world. This na una program where they cancel una every 2 weeks on Saturday afternoon. Well body na gently with Dr. Mafudia Soare and me, nurse Inez K. Today we get a very special program for una on mental health. Yes, we come for can talk about things that we can bother the mind, like depression, anxiety, and other affect sick them where they bother the brain or the mind. We get a very special guest today where you can tell me more about this sickness. Dr. Mafudia Soare, do you tell me what we get today at the program?
Yes, me family, Leone. Good afternoon and good evening. You know, I really don't look forward to this program today on mental health because as something where we not really they talk about much now with culture. In fact, as far as I know, most of the language then na salon not really get specific word for describe some of them serious, emotional or mind problem then way people then can get. So, things like depression and anxiety. And you can help me, Mr. Inez, because you Creole past me. But, waiting really, direct Creole word day for depression or direct Creole word day for anxiety. I know say I ask me, Mama, pantimni, if they get word for that, they're not able for come up with a specific word. It come with some word then where they describe some of the behavior then where person can get where you get then condition then they, but not a direct, word. So to me, then they tell me say, if you not get word for that, problem there, how you go able for talk about that problem there? How you go able for describe to people there and how we go able for deal with that. So now some of them things and they go through my mind and and hopefully Dr. Mondeh go able for help with small in a experience. So we get with Dr. JD Mondeh, we na psychiatrist and also na certified psychotherapist. And I will make my explain what exactly the two things that they mean. Because again na two specialty then they will also come on one for me, but people then they interact with, we know about Chris Man and Chris, but anything where they below Chris Man, what exactly then they mean. So now some next thing and they will get for the touch on. But first I go allow Dr. Mondeh for introducing himself. They may tell we waiting exactly in a psychiatrist and waiting as psychotherapist so that we people are going to understand what this man really they do. And then we'll go into the main question there. Dr.
All
Mondeh.
right. Thank you very much, Dr. Mafudia and Inez. Thank you very much. And Mr. Mohammed, we do the technical job. Thank you all very much for this invitation. Now, when I get the invitation for come onto this program, really at relatively short notice, I've been happy. Not even think for a second, say, oh my God, this is an inconvenience for letting invite me at relatively short notice. Nothing say nah, by willful and do I think that just the circumstances, but all the same, simple question, what they do and what in the terms psychiatry, psychotherapy mean. Now great, first of all, me and I are psychiatrists, but really in the UK, they say consultant psychiatrist. That means somebody with in the discipline don't reach quite a high level, then they call them consultant. And with great humility, I don't know, did this for over 20-something years as a consultant psychiatrist.
Wow.
And they treat all aspects of mental illness where possibly can arise in people. Now, psychiatry really basically not about anything will go affect somebody in mind, in thoughts, in behavior, all resulting from some which we can call sickness of the mind, sickness of the brain, the mind, etc. Psychotherapy, when person they try use skills and techniques or talk to somebody without medication for source that person problem. Try get an understanding of the problem and try get a resolution of the problem. Then a psychotherapy and plenty different aspects and styles and ways and the way man can practice the psychotherapy. In all my training, do this in Germany, and the Germans then they know very well. You will literally say in inverted commas, they're not one of the first people that will really popularize psychiatry and psychotherapy. Now in psychotherapy, we get a famous man we then called Sigmund Freud. Now Sigmund Freud been discovered say Ines been talk about anxiety. It been discovered say some people can become quite anxious, can develop problems where they see a real medical pathological problem, but then get a problem. So it began exploring people then through talking, the famous couch we've been getting, they sit up on the couch or they don't on the couch, they talk to them and they sound them and get to the core of the problem and try help them. So that's aspect 9 as psychotherapy. But a skillful thing, not all man able to do. Not to just when you talk to somebody, you must get the skills for able to talk to that person and explore your mind. So now that partner is psychotherapy. So now that's needed do psychiatry, psychotherapy. Yes, really by dint of my own training and experience, also do what they call neuropsychiatry. Neuropsychiatry means the combination of neurology and psychiatry for try explore and understand people their illnesses. So really, I'm not going to talk about the neuropsychiatry much, but I am that as well.
Wow. Miss Ines, I will make
Yes.
my start with the question then, because we'll get now bookman now we'll get so. When I say master savvy people, then now the master for the master.
These are real master savvy person. Now we get so today, all side qualified.
Yes.
Yeah.
And we get for take time and not begin analyze we say. All right. So today look like we get a very exciting program.
Yes.
So with that, Dr. Mondeh, is there anything unique about mental health problems, the way they affect with people then as Sierra Leone or Africa compared to West African nations? Oh no, sorry, I think I don't jump small. I don't go before, no go back beyond small bit a bit.
No worries. Yeah.
No, what I go and let you do first. If you can tell me small but you experience, what are the common mental health issues then, where they affect people in Sierra Leone and the diaspora? And the common symptoms then.
Yeah. Interestingly, even though I don't work in Sierra Leone before, years ago, at the time, me not to be psychiatrist, but I don't work in Sierra Leone. And without any doubt, and even my subsequent visits to Sierra Leone, including teaching in Sierra Leone. I don't teach them, lecture there, the medical students of the 3rd or 4th year School of Medicine. I'll say we get similar problems, some of the similar problems we then get in Europe, whether schizophrenia or psychotic illness or drug-related, substance-related illnesses. Anxiety will not be the talk about, quite a lot of that. But one of the things we now they talk about one a serious problem in Sierra Leone. The issue of anger, the issue of what we can call the social personality. That means somebody will just wicked to other people, somebody will just they behave badly to other people. Now the reason we make kind of raise this, now thing with the Hamburg we country seriously. And I don't think so we don't really fully understand and appreciate the difficulty with other cause. But Ines, if you don't mind, I'll come back to your question. Which are the most common ones then? If you go to the hospital, you find people that we get, when I say Christmas, that's schizophrenia. You find them. I don't go to the hospital. I don't see the people. Sometimes they can chain them. I don't see all of that. You get people that we get within they can call bipolar affective illness. That's one day they look gladdy and then believes it and get extra powers, then believes it and gets great abilities. Shortly after they feel very depressed. That's now we call manic depressive illness or bipolar affective disorder. Then the anxiety one I talk about, it is plenty, that's alone. No question about that. Now, what did they cause this anxiety? Anxiety now when somebody, first of all, anxiety not a normal thing would happen to everybody. I can always tell, give the example. If you did drive your car, I'll say you did just drive normal speed, speed, just normal speed you did drive. And then all of a sudden, a 3 or 4-year-old picking jump at the road. You go quickly mass your brake. And when you mass your brake, in that moment, your heart go beat fast. You say, oh my God, sometimes I've been killed this speaking, but you're not kill them. But for a few minutes, that experience we get, I call anxiety. And it happens to everybody. Now, the anxiety when a sickness, now when they stop, it continue and continue and continue. And anxiety very much associated with worries. So, what are the key things where people they worry about? Finances. The next thing that they worry about, work. The next thing that they worry about, family life. The next thing when they worry about, they don't do something where sometimes will make them shame, will bring disgrace on them. And sometimes they can know some of the things we they don't do. So all of them get to worry people. Or worry about sickness. For instance, this whole COVID thing, the amount of anxiety and depression we don't cause, it's just unbelievable. Just a few weeks ago, I attend the Royal College of Psychiatrists International Congress, and a lot of the discussions were about anxiety and depression and naturally other things, but a lot related to COVID. So your question where you ask, which are the common things in Sierra Leone? Before this panel discussion, I actually check again because it's unbelievable. But amongst the 10 most common things where they affect people in a salon, interestingly, no mental health condition in all list amongst the 10 most common. That don't mean say we not get mental health problem. I not say we not get. I just say amongst the 10 most. The first one are malaria, then lower respiratory infections, neonatal disorders, diarrhea, ischemic heart disease, tuberculosis, stroke, congenital defects, HIV/AIDS, meningitis. Those are the 10 most. Now, please understand, and I say no mental health problem, no they, then they. I remember when I decided for specializing psychiatry, I mean, in Germany, people then say, that's I don't train as a doctor qualified, I don't work. People then say to me, Joseph, why you want to study psychiatry? We Africans will not get psychiatric problems. Now, the reason we make her say this, very serious-minded people believe say Africans do not get psychiatric problems, but me no see.
Wow.
Me no say get. I'll get a lot of them.
Yes.
Now, Dr. Mafudia been talk say he asking mama what's the name for Christmas or depression, and the mommy not able give an exact explanation. He give what we call paraphrasing, he describe, but he not able to give an exact word. You're absolutely right. You take any of the other languages in Sierra Leone, you'll find out say none of them not get exact words for this.
Mm-hmm.
So you'll find out when they're depressed, they're not able to express depression, past and say something, they get aches and pains.
Mm-hmm.
And the question where you ask, I don't get calls from people, and I don't actually help and direct people in treatment right from here. Tell them waiting for buy, waiting they need, etc., etc. So without any shred of doubt, we get the problem. So come back to your question, Ines. I'll say schizophrenia there, depression there, lots of anxiety there. Then we get probably amongst the younger people things like ADHD, attention deficit hyperactivity disorder. Waiting, as I said earlier on, we will not look, but we consider that a type of psychiatric problem. The level of anger within in the community, it don't almost reach a level where I'll say now like a sickness. Yeah.
Wow. It remind me, I know say na me work now can get patients away, they get what's they call it, like explosive behavior. They
Absolutely.
where they say
Absolutely.
it just bust no more. It just
Yeah.
blow up no more. Then we dip and talk
Yeah.
fine, and next thing you know, it just blow up no more. It begins scatter, begin fet. With the
Correct.
then with their intermittent explosive
disorder.
disorder.
Yeah.
Mm-hmm.
Yeah.
Mm-hmm.
IED, intermittent explosive disorder. Absolutely right. Yeah. Yeah. Yeah.
Yeah.
Correct.
And and now very, very important things, and then the way they affect people then. So then the question is, if somebody even recognize some of them symptoms you have, so by himself or by in Pekin or in man or some of in family, whose kind treatments are really they for the other, because you they talk say they sickness of the mind. How would they treat them while they able what do you direct treatment and a salon we be talk say some people then?
Yeah. When you ask the question, the most common ones, I don't give them, but like just say something where I don't give talk on, I don't give lectures on, etc. The unfortunate situation we've been finding ourselves in as a country from 1991 to 2002, the so-called rebel war, some people call it civil war, although mostly not being a rebel war. Now, the unfortunate thing with a rebel war do, now, which we call post-traumatic stress disorder. And interestingly, I don't actually give a lecture on that in Freetown, Ministry of Health. This was way back in 2010. Now, you see, you're not able to solve problem until you understand. First of all, recognize and then understand the problem. Until you recognize and understand the problem, you're not able to solve it. And at this don't be necessarily, unfortunately. We not get enough people we actually able to recognize this as a problem. And if they recognize, they not get the understanding of how to solve the problem. Okay. And the difficulty with this, with post-traumatic stress disorder, it can cause plenty things, including depression, including anxiety, but all this explosive behavior where you just described, say you don't hear it, people can get. All of that, I believe, say quite a bit of that's not due to this. I don't blame anybody, maybe listen at the circumstances, the war don't contribute to this. But your question, Nabin, how for treating people here? Now, Dr. Mafudia, you're not a doctor. And it no matter which condition on earth, it not really matter which condition. For treat successfully, you first get for diagnose successfully.
If you get question, then una can send to question then on our Facebook page, on Twitter, on Instagram, or even email we na wellbodysalon@gmail.com. Again, this is Dr. Mafudia Aswari. Thank you for waiting to watch the video. Stay tuned for our next video.